Okay. So our plan for the next hour and a half or so, perhaps hour 45 minutes, is that we're actually going to start our meeting today with resource sharing. We usually end our meeting with resource sharing, but just because our meeting today is so data heavy and content heavy, we just wanted to make sure that folks have a chance to share their resources while you're still fresh. And not that you're going to be tired and exhausted by the end of the meeting, but we recognize data can be a lot. So we're going to start off with resource sharing, and then we are going to give an overview of some of the recent data that we've collected through the collaborative as well as through the school district, and talk about why we're sharing the data today, and then take some time to do some meaning making work around the data and how the data reflects upon your organizations or in the work that we do as a community. So we'll start off with resource sharing. So it's an opportunity for you to give any program updates on what's happening within your organization, any upcoming events, any like issues that you want to throw out to the collaborative. And it's fairly informal. So please just either raise your little virtual hand, or you can put in the chat box that you would like to share. I'm going to move on to the bulk of our agenda, which is really an opportunity to look at some of the data that we've recently collected. So there is a bunch of slides. So if you would like to see the slides in Spanish, you can click on the top of your screen where it says view options and scroll down to where it says see slides in Spanish. I was going to read it in Spanish, but I thought I would save you all from my poor accent. And again, mobile phone users do not have this option, so we apologize for that. And then Sandra, I would say my other apology is I added a couple of slides this morning that we did not translate in the beginning. So I just wanted to apologize for that on the front end. Okay, so we're going to spend a couple minutes kind of framing our discussion today. So Christina, please jump in if I leave anything out, because I want to make sure that everyone's clear what we're doing and why we're doing what we're doing. So for those of you that are new to the collaborative, or for those of you that have been a member of the collaborative for a while, we just want to remind us all that we are actually a data and story-driven collaborative. And so we have been collecting data in the areas of health, education, and economic well-being since 2007 for a couple different reasons. One, we really want to ensure that as a collaborative, we are focused on the areas that are most, that will be most impactful to our community, and the areas that are really kind of the greatest areas of concern. And so we've been looking at data to say, hey, like, where do we need to come together as a collaborative to improve, outcomes in a specific area? Can we use data to show if we're actually making improvement in those areas? So to collect data, we've been using a lot of different methodologies, a lot of different data sets over the years. We've been producing a community report card since 2007 that compiles all those data points. We've recently done issue briefs. We have some online iterations of our issue briefs, as well as some online software that we use. So we collect data and we share it in a lot of different ways. And over the years, we've really shifted our data collection work to ensure that we're disaggregating data, so that we look at how we're doing as a community as a whole. And then we also look at very specific disaggregated data sets. So we look at data by gender, we look at data by income levels, we look at data by ethnicity, and any other ways that we can break apart data, because we know oftentimes if you look at data as a whole, we can be doing fairly well as a community, but when you start breaking down data into disaggregated subsets, we really can see disparities and where we need to focus our collective efforts. So that's one thing that we've been working to disaggregate data. And we also recognize that there's limits to data collection, that oftentimes data will paint one story, but when you start kind of taking, when you start talking about the data and having discussions about the data, we recognize that there may be some limits to the data collection, or gosh, like that doesn't actually reflect how we're doing in this area. So we feel like it's really important to not only share the data, but also take time to do what we call meaning making. What are the stories behind the data? How does that data actually play out in the community? And we feel like it's really important to bring the data to you all as our key collaborative members and participate in some meaning making work, so we can really understand as a collective what's happening in our community, where we need to focus effort, and how do we use our data to make decisions and inform our broader work at a collaborative level as well as the agency level. And then we are also really mindful of what I'm calling today kind of trauma-informed data sharing. So oftentimes when we share data, we see ourselves in the data, and it can be fairly impactful. So for example, my family has experienced a number of substance use disorder issues on all sorts of different levels. And so oftentimes when I see our substance use disorder data, it brings up a lot for me. So I just wanted to remind people of that and to be mindful of that, to take care of yourself. And we are mindful of that as collaborative staff, that the data that we're sharing can be triggering or bring stuff up for folks. And so just treat yourselves with care, take a step away if you need to. We are on Zoom, so turn off your camera. But again, just be mindful of that piece. Okay, next slide, Christina. Okay, so for our goals for today, is that we are going to provide a fairly high-level overview of a couple different data sets. And then you will all have an opportunity to take a deep dive into specific data areas that we're bringing up. So kind of the caveat is that we've done this historically as a collaborative for the last, like probably 10 years or so. We've only done it virtually a couple times. So for those of you that have been part of the collaborative for a while, you will recall that we've done this in the town hall, in the Truckee town hall, like up in the chambers room, where we'll have data printed out on flip charts around the room, and you have an opportunity to like physically move your body and look at the different data sets, talk about how the data impacts your work. Because we are meeting virtually for the foreseeable future, we've tried doing this in a couple different ways virtually. This is the first time we've done this with this many people in this way. So we ask for a little grace and a little patience. And again, the intent is just to give a high level overview of the data, give you an opportunity to take a deep dive, and then also really point you in the direction where you can find the data. We recognize that it's great to hear data once. It can be challenging to hear a lot of data at once. And then we know that many of you will want this data for your own work with your organizations, to write your grants, to share with your stakeholders, to share with your other staff. So we want to make sure that you know where to access that data and how to access that data. And again, like if you have questions about the data after we end today, please email me or Christina, and we will sit down with you, talk it through some more. And as we go through the data today, please put any questions that you have in the chat box, and we can do our best to answer your questions as well. Okay, next slide, please. So as I was getting ready for today, I found this little quote I just wanted to share with you. And it's from a website called Trust Radius. And what they say is that 74% of employees report feeling overwhelmed or unhappy when working with data. So my hope is that we are not making you feel overwhelmed or unhappy as we're talking about data in the next hour and a half, but we just recognize that data can be very overwhelming at times. So I just want to share that slide with you. Okay, next slide, please. Okay, you could probably scroll that. Yeah, thank you. Okay, so the first set of data points that I'm going to share with you is from the 2022 Community Engagement and Behavioral Health Survey Report. And so many of you helped participate or helped disseminate the data, the survey to our community members about three months ago. So this is hot off the press. Just a little bit of background. As a collaborative, we have been tracking data, like I said, in the areas of health, education, and economic well-being for many, many years. Specifically in the area of health, we look at a number of different indicators in a number of different areas. One of the main areas that we focus on is around mental health and behavioral health. And as a collaborative, we have spent a lot of time over the years focused on behavioral health and mental health for lots of different reasons. And so we are really fortunate that we now have a survey that is specifically focused on mental and behavioral health. And so we have data that we'll share with you today. We also want to acknowledge that the hospital has really robust data as well through the community health needs assessment. And we are hopeful that we'll be able to share that with you all through this meeting, probably in August. So today we're not talking about the hospital data, we're just talking about the data that you all helped disseminate the survey for a couple months ago. And so the data that we're sharing today is data from the second survey that we have conducted. We conducted the first one in 2020. And there's a bunch of questions that reflect social dynamics, party culture, community connectedness, stigma, mental health awareness, treatment. So we have comparison data now, which is awesome. So we have 2022 data, and we're able to compare that to 2020 data. And then we also have some provider survey data that we collected over the last 6 weeks or so that we'll be sharing with you today. Okay, next slide, Christina. So again, this 2022 Community Engagement and Behavioral Health Survey report, we're going to talk about that first. After that, Kim Bradley is here from the school district. So thank you so much, Kim, for joining us today. And she'll be giving a high-level overview of some of the findings from the California Healthy Kids Survey. And next slide, please. So as far as the Community Engagement and Behavioral Health Survey, we launched it back in the spring, and we do it in partnership with 2 other mountain towns. So Eagle County in Colorado, which includes Vail Resort, as well as Summit County, Colorado, which is Breckenridge, Keystone, and I think Arapahoe Basin. And we are in a partnership with mountain towns across the Western United States, primarily through one of our primary supporters of behavioral health services in the Tahoe Truckee area, called the Katz Amsterdam Foundation. So for those of you that are unfamiliar with the Katz Amsterdam Foundation, Rob Katz is the former CEO of Vail Resorts and is still involved. And he and his family started a foundation, so a family foundation that focuses specifically on behavioral health issues in kind of the communities where there's Vail Resorts. And so we're really fortunate that they have supported a number of your organization, or a number of the organizations on this call, as well as some kind of systems level behavioral health issues. So one of the things that they fund is this data collection, and we're doing it through the survey. So that's why we're doing it in partnership with Eagle County in Colorado, as well as Summit County in Colorado. So throughout the data that we share today, you'll see comparisons to those 2 other communities, as well as a couple other communities. So it's kind of interesting to say like how we're doing on par, or how we're doing compared to other ski towns. So the way the community survey was conducted is that there was some random-based or some phone-based random sampling, as well as some internet-based community outreach. Next slide, please. Okay, so we collected 858 surveys. There were 350 phone surveys that were conducted, 508 internet surveys, and I want to thank Felicity and the team at Sierra Community House and all the promoters that are on the call for your outreach to our Spanish-speaking population. We are really grateful for all the work that you did, and are really pleased and proud of the overall number of surveys that we were able to collect as a community. And it's not really a competition, but I feel really good that we collected more than Summit County and Eagle County. So strong work, everyone, strong work to you all, because you were all the ones that did it. Okay, next slide, please. So we just want to take a moment and talk about who you will see reflected in the upcoming data points. And so basically, the bar line on the left side is the actual population, and the dark blue line are the folks that are actually represented in the survey. So it's pretty much on par. So you'll see, if you're curious, if you start on the left, what this says is that there was about 55% of sorry, I have like a little COVID issue at school, so I'm a little bit distracted, of survey participants were broken down this way. Christine, I just need like a quick second. Okay, sorry, I just had to see if I had to pick up my kid, which I don't. Okay, so these are the sample characteristics, again, of who you'll see represented in the survey. Next slide, please.
Sure. Did you want to touch on the income at all, or?
No, not right now. Okay, so what have we learned? So we know that, so let me actually talk about this for a sec. So on the dark blue line is the survey that was collected, the data that was collected in 2020, and the lighter blue line is the survey data from 2022. So we know that there's been a slight increase in the average number of poor mental health days per month, and it's certainly not surprising. And we know that this is most likely wrapped up in the pandemic, but we are not sure how much is unique to rural mountain towns or just indicative of what's happening across the country in general. And so, Lizzie and Maria and other folks from the hospital that are on the call, I look forward to looking at this data in partnership with you all with the community health needs assessment data as well. Okay, next slide, please. Okay, so overall, we've seen some slight changes in indicators. And so again, just to frame this a little bit better, so I totally apologize. I'm going to just share a couple of high-level data points, and then we're going to take some deeper dives into some specific areas. So overall, we've seen a slight increase in a number of indicators that are primarily in the areas of substance use disorder, alcohol rates, and drug usage rates. So you'll see that there's been a slight improvement in binge drinking, heavy drinking, excessive drinkers, and current drinkers. And we know that there's been a bit of a bigger improvement in the number or the percentage of folks who feel that alcohol is important to us in our social life. So that is good to see. On the flip side, there has been a few negative changes in the data overall. So we know that, like I said, there's more of us who have experienced more poor mental health days. Our trust in our community has declined a little bit. The number of folks who are feeling left out has increased. So again, some overall improvements, some overall areas where we're not doing as well. I know some of the language on here can be a little bit confusing. So Christina, would you mind dropping, if you're able to, the actual report in the chat box as well at some point so people will have access to it if they want to take a look as we're walking through here. But overall, some improvement around drug and alcohol and some declines in the areas of kind of like community connection. So we're going to take a deep dive into some of those pieces over the next handful of slides. Next slide, Christina. Okay, so the next handful of slides, like I said, are around social dynamics and party culture. So we're going to look at drinking rates. We're going to look at how we feel our community is as a place to live, and some indicators around loneliness. So the first slide is, again, the number or the percentage of adults that are excessive drinkers. And so one of the things that we've talked about as a collaborative over the years is that we really want to better understand our drinking habits as a community. We've talked a lot over the years about, what it's like living in a town that really focuses, or that has an emphasis at times on kind of a party culture. We often talk about that in conjunction with being part of a tourist town. It's a lot of the work that, the good work that Ford has done over the past 10 years, and that kind of the new iteration of Ford is focused on. And we also know that we really want to focus, or this data is really focused on the kind of drinking that can put people at risk. And what's excluded in the data is numbers that reflect casual drinkers. So excessive drinkers, just to be clear, are folks that are just defined as either heavy drinkers or binge drinkers. So we can see from this slide that there's been a slight decline in the percentage of adults that are excessive drinkers, and a slight decline in the percent of adults who believe alcohol is important to their social life. So next slide. And then just a little caveat as well. Our vision is sharing this data, and then we're gonna give you all some time to kind of break out into small groups and kind of reflect on the data and participate in the meaning making part. So feel free to take some notes if you'd like, and you will also be able to access some of these slides and some of the data points when you're in your small groups. Okay, so the next couple of questions that we surveyed our community around are how folks perceive Tahoe, Truckee is as a place to live. And so we know that we've seen an increase in the number of residents who feel Tahoe, Truckee is a poor or fair place to live, and that the greatest increase we saw is in folks who fall into the 18 to 39 category. So thank you, Christina, for doing that. And folks who are low income. And so to qualify as low income, we are following the federal poverty guidelines. And so low income folks are making anywhere between $26,000 and $53,000. So 100 to 199% of the federal poverty level. So again, when we talk about supporting our community across the board, I think these data points are quite telling. And again, one of the things that we're really cautioning about is that because we have 2 years of data, we only have 2020 and 2022, we're really cautious to establish any trends at this point, because you really need at least like 3 data points to establish a trend going either way. However, I think this data can certainly inform our work, and also is indicative of what we've been experiencing as a community, as a country, and as a world around the pandemic over the last couple of years. So again, just intended to provide some information. Next slide, please, Christina. We also looked at levels of loneliness. And so loneliness is defined as respondents who answer 3 questions. And actually, Christina, could you go to the next slide, then we'll maybe backtrack to this one, please? Okay, so there's 3 questions that were surveyed that many of you probably completed. One was around companionship. The second is feeling left out. And the third is around feeling isolated from others. So you'll see that a little less, sorry, okay, so North Tahoe is the 3rd bar on each of those graphs. Thank you, Christina. And that about half of us feel lonely often or some of the time. And so again, just information, I think when we often talk about community connectedness and how do we help folks engage in the community, just recognizing you know, how folks are feeling. And then Christina, if you wouldn't mind backtracking to the other slide, please, who is feeling lonely. And even though there has been a slight decline, like for me, like those rates are still quite high, and I think is really helpful to inform our work. I'll give you all a sec to look at that. Okay, next slide, Christina. So we also had the option of asking additional questions on the survey. So many of you were helpful in informing those questions. And so we asked a question, have you ever been the victim of intimate partner violence or emotional abuse? We were the only community that asked this question, and we did not ask it in 2020, so we do not have any comparison data at all. However, we wanted to bring it to your attention. And if you look across how the data is disaggregated, we can certainly see that women have experienced intimate partner violence and emotional abuse at a greater rate than men, 40 to 64-year-olds, middle to high income as well as low income, it's pretty on par. And I think what's really telling is our LGBTQ community members have experienced intimate partner violence at a much higher rate than our non-LGBTQ residents. Thanks, Christine. If you wouldn't mind moving on to the next slide. Okay, so our next couple data points is around behavioral health knowledge and attitudes. So we have focused a lot as a collaborative, and many of you have focused a lot on not only stigma reduction, but how do we really help community members be aware of mental health resources in the right time and the right way. And so we are pleased to see that there has been an increase across the community and the awareness of providers, programs, or resources available to help people with mental health needs. So that is encouraging to see. Next slide, please. And at the same time, we know it still isn't easy to talk about mental health or emotional challenges. And kind of across the board, across all subsets, you know, almost half of us find it challenging to talk about mental health issues. So again, I think one of our most greatest community challenges around behavioral health, and certainly this is not unique to Tahoe, Truckee, however, I think it can be exacerbated in mountain towns, is just a stigma around accessing services, and that, you know, oftentimes we have a attitude in mountain towns of kind of getting it done and like pulling yourself up by the bootstraps, and that I'm talking about mental health and behavioral health as a sign of weakness. And so I think it, again, continues to be one of our greatest areas of work around how do we help reduce that stigma and help folks talk about mental health and normalize the conversation, and that accessing behavioral health services is just like accessing any other kind of medical service. Next slide, please. Okay, so I just have a couple slides about treatment, and then I will be done. Next slide, Christina. So one of the questions that we asked was specifically about how frequently people needed mental health services. And if you look on the red bar on the far right, we know that 33% of us said that there was a time in the past year when we needed mental health services. And again, you can see it broken down by populations in our community. And again, I think what's telling to me is when I look at this, that, almost 42% of 18 to 39-year-olds, 42% of low income folks, and 45% of LGBTQ folks indicated that there was a time that they needed mental health services. So again, as providers, kind of paying attention to who those folks are and how do we, outreach to specific parts of our population. Next slide, please. And we also asked, what kind of services do people seek? And again, just a very high level snapshot. We know that 40% of folks looked for or tried to access counseling, therapy in person. 17% tried to access remote therapy or virtual therapy, which I think is a conversation that we are continuing to have around virtual services. And due to the pandemic and so many things moving online, is this a moment in time where we can leverage technology and leverage the kinds of services that are now available virtually, which previously have not been available to us being in a fairly small rural mountain community. And again, you can see the other types of services that folks sought. Next slide, please, Christina. And then among these respondents, most were able to get the services they needed, while 22% were not. So out of every 100 people in our community who need care, 58 folks received care, 22 people received care but faced significant barriers that prevented it and were not able to get it. And so cost, appointment availability, et cetera, and then 20 people who needed care did not seek care at all for unknown reasons. So again, just telling when we talk about how do we help people access care who need it, and what's kind of getting in the way of folks, and what do we do as a collaborative and as a community to help reduce those barriers. Next slide, please, Christina. So the final piece of data that I wanted to share with you from our community survey was specifically focused on providers. And so we worked with the same company that did the behavioral health survey, the community survey. They're a company called PRC, and this is kind of what they do. They conducted a provider survey. And so the methodology was similar. There was some phone-based random sampling, some phone calls made to providers, as well as some internet-based surveying done as well. We did this in partnership, again, with Eagle County in Colorado, Summit County in Colorado, Park City also participated in the provider survey, and as well as providers in our region. And again, we defined our area as the Tahoe Truckee Unified School District boundaries. So that's kind of the collaborative impact area. So it's a 720 square mile area in the North Tahoe Truckee area that goes along the I-80 corridor from the Summit down to Floriston, includes the Truckee North Tahoe area up to the state line. And so again, providers from that service area filled out this survey. We had 46 responses, and we included the definitions of providers on here as well, because it's fairly broad. So it's licensed clinicians, it's MDs, it's master's levels, folks who are providing services but not necessarily licensed, as well as certified addiction counselors who work in the field of substance use disorder, as well as community health workers, case managers, peer support specialists. So it's a fairly broad definition of providers, and we're just beginning to unpack this survey data. There is so much data that we, again, we're pulling kind of pieces just to share with you all today. And there's definitely other provider survey data that we can look at with you all as we slowly start to work our way through it. But we just want to share one data point from here. Next slide, please, Christina. Okay, so this slide reflects the percent of providers who accept insurance by type. And so North Tahoe is the third line down. And again, the question to the providers was fairly basic. Do you accept the following types of insurance? And so you'll see that of our providers who accept insurance, 14% accept private or commercial insurance, 21% accept Medicaid, 16% accept Medicare, and 7% accept VA benefits. And what I'm curious about unpacking this more with, and Jasmine, I know you and I have just talked about this a little bit, and Christina, we've started talking about this, is does that reflect the total people who take insurance? And as a collaborative in a community, how can we further support providers to take insurance, and what kind of infrastructure can we put in place to really increase those numbers across the board. And again, like I think when we compare our this data compared to our other similar like communities across our rural mountain towns, it just kind of further exacerbates it. There's some work to do in that area. Okay, so that concludes this data. If you want to put any specific questions about the data in chat boxes, we can do our best to answer them or get back to you, or I can answer them in a little bit in the meeting. And again, I know it's a lot of information, and the intent is just to provide a high-level snapshot and then do some deeper dives into the data in some small groups. And again, make sure that you all have access to the data. So why don't we take like a 5-minute break, Christina, just because I know it's a lot. We've all been sitting here for an hour. So it's 11:06. So why don't we come back at like 11:11? And then at that point, we will turn it over to the esteemed Kim Bradley to give a high-level overview of the California Kids Healthy Survey data. So welcome back, everybody. Christina, thank you for the super calming music. I really appreciate it. It was very relaxing. Okay, so the next chunk of data that we're going to talk about today is from the California Healthy Kids Survey. And Kim, I really appreciate you spending time with us today. I know it's a super, super busy time of the year at school. So yeah, thanks for sharing your insight and wisdom with us. And then process-wise, we'll hear from Kim, and then we are going to have an opportunity to break into small groups to kind of do a deep dive into any of the data that I just talked about or any of the data that Kim will talk about. So be aware that that is coming. All right, Kim, thank you very much.
Great, thank you. So for those of you that aren't familiar, the California Healthy Kids Survey is done throughout the state of California every other year. In the past, we had done 5th, 7th, 9th, and 11th graders, and we would do it in the spring every other year. And then as of last year, they changed it to where now it is 6th, 7th, 9th, and 11th. If you can go to the next slide. The survey is designed where it's anonymous. And so students are encouraged to be able to answer the questions honestly. And it addresses school climate, safety, student wellness, and youth resiliency. Next slide. It is done as a self-reporting survey assessment. So it's really based on individual students' experience and how they respond. It measures both risk and resilience factors. It's given to over 600,000 students in California. And it's used to report aggregate district level data. And it really focuses on the health of our school community. So it's hard to like pinpoint individual students, but it gives us a trend and an overall sense of where students are at given that year. So next slide. So something I want to note is this data is based on 7th, 9th, and 11th. We just started doing 6th grade, so we didn't have any data to compare to that. So we were just focusing on the 7th. And then I highlighted grade 11 because in order to be really statistically accurate, it needs to be 60% or more. So it's slightly lower participation than we've had in the past. And so we're still looking at that data, but we're wanting to recognize that it's not quite as large a pool of students who took the survey. This was when we had come back from distance learning. We still had many students that were doing hybrid or distance learning. And so we feel like we weren't able to capture as high of number as we have in the past with our 11th graders. Next slide. So this is really just going to give us an overview of some of the areas that we are looking at, both through our student services and our wellness department to see what kind of shifts we're seeing with how students are feeling, both social, emotionally, and with their drug and alcohol use. So the first one we want to look at is how supported do students feel at school? And so what we're seeing that students had reported feeling more supported in May 2021 than they had in previous years. And I'll be totally honest, like this was surprising to many of us in the schools because it's been such a hard couple of years and we've done so much to try and reach out to students, but many of our students who are struggling the most were often the hardest to reach. They wouldn't come to class, they wouldn't turn their cameras on. When we came back to school, there was masks and it was just harder to connect. So we were pleasantly surprised to hear that students felt supported. One theory we've thrown out, and this is just speculation, is that it has been such a hard couple of years that there was a sense of relief at being back at school last spring and having some kind of normalcy, even though it was on a hybrid schedule, minimum days, masks, that students and staff celebrated being back and realized how much we had missed being in school together and how hard it was learning at home on our own. So I don't know if that played a factor or not, but that's something that we considered. Next slide. We've also seen an increase in students reporting a high level of school connectedness. So feeling like they are connected and part of school. And this is similar to our thinking that maybe because we had been missing that for so long, that there might have contributed to an increase. But we also hope that this may also have to do with some of our efforts through the school district. We've really tried to support our teachers and our staff in reaching out to students. We do a caring connection survey at most of our schools where we have students identify staff that they feel they have a caring connection with. And we really try and promote those connections throughout the school year. We've been trying to do more restorative circles in the classrooms where we're taking the time for teachers to connect with students beyond just the academics. And we've really just tried to increase our wellness and social emotional supports and learning. So we're hoping that has played a factor into seeing the increase as well. Next slide, please. Students are also reporting feeling safe at school. And so you can see this has fluctuated. In grade 7, during 2016, it was 75%, as well as in grade 9, and it went down in 2018. But we're staying kind of right in that range in 2021, which is really great for us to see that students are still feeling safe. There has been so much uncertainty and kind of unease for all of us, especially for our students who've been home, and oftentimes their home situations haven't always been easy. So that school feels like a safe place for them, feels like a really important data point. Next slide. What we are seeing, though, is an increase in students who've seriously considered suicide in the past 12 months. So if you notice, when we first started with 9th graders in 2012, and that's when we actually first started our wellness centers and really brought in a lot of our community collaborative resources and supports, it was at 30%. So it's still considerably lower than what it was, but we have seen that it's gone up from 13% in 2016 and 10% in 2018 with our 9th graders. And it's gone down slightly with our 11th graders, but it still feels high. Unfortunately, we do not have the state data yet so that we could compare what is the state average, and I'd be really curious to see what the state average is right now. Because as we were seeing with our community collaborative survey as well, like there has been an increase in mental health challenges across the board, and we are seeing that with our students. Next slide, please. So similarly, we are seeing an increase and students reported feeling sad or hopeless within the past 12 months. So that this has gone up across the board with our 7th, 9th, and 11th graders. And it isn't the highest we've hit, but it's pretty close. And as much as the supports we're providing, like during the pandemic, we were able to get emergency COVID relief funds and bring in school-based therapists who could both meet with students virtually and in school. We've brought on school social workers, we've brought on school interns. We've really been working closely with our mental health providers, and yet the need is growing. So it's almost like we continue to offer these supports, but the need is continuing to grow. And that's what we've also seen anecdotally at school. There's just a high number of students that have been struggling. And some students that we didn't have on our radar before, that we realized that might have just been quieter and not showing us just how much the struggle was these last couple of years has really brought that to the forefront. Next slide, please. With drug and alcohol usage, overall, we are trending down. And so you can see we have alcohol, binge drinking, marijuana, prescription drugs, and cigarettes. All of those numbers have been going down. Our most recent numbers show in the orange. And so you can see they started off pretty high in 2009, 2010. We had some peaks in 2011, 2012. And then overall, it's been going down. We had a little bit of a slower decline with marijuana usage, but we are seeing that trending down as well. The next few slides just kind of go through each of those areas to show you what those numbers are. So if we could go to the next slide. So this is students reporting alcohol use in the past 30 days. And so this has gone down for 7th graders, 3% reported alcohol usage, 9% of 9th graders, and 14% of 11th graders. I did see a question from Kevin that I'll just answer right now. And if you have questions along the way, I'm happy to answer them. These surveys are given out in class, and we set aside time for those students to complete them online. And so they get a link and then they answer the surveys online. We had some students that were doing distance learning last spring when we had these done, and so it was a little bit harder to get all the information back. If you could go to the next slide. And so this is specifically for binge drinking, and that is we consider 5 or more drinks in a row. So the number of 7th graders is 1%, so that's staying pretty consistent. The 9th graders dropped a point, 3%, and our 11th graders went down 9%, which is the lowest it's been. When you look at 2010, it was at 29%. You know, Forward has been using this data, and I definitely think our efforts as a community to really talk about drug and alcohol usage and shift our cultural norms. I also think our Athlete Committed program has had an impact. That's a peer-to-peer model where students are trained in kind of what it means to be in their optimal health as athletes. And then they've been spreading that messaging to their teams, and they've also been presenting at our middle schools. Most recently, they did presentations about vape education. Because of all the things we're seeing right now, vaping is actually up. And I'll show that slide at the end. Okay, next slide, please. With marijuana usage, we kind of had a slower decline, as I was mentioning, but we are seeing that lower than what it has been in the past as well. And then the next slide. This is interesting because when we looked at that original chart that showed the down trends, it was really looking at cigarettes, e-cigarettes. What we did not track was vaping. And so we don't have a data set to compare vaping, but we are seeing an increase in vaping, both with our data and anecdotally what we're seeing with students in the schools, in particular getting in trouble by vaping in the bathrooms has been big both in our middle and high schools. And so we've been trying to up our education and awareness, and it's why our athlete committed focus this year was on vaping at the middle schools to try and educate our middle school students about the harms of vaping. I still think there is a perception out there that it's harmless and there's nothing in there, but they're really trying to educate about the chemicals and the addiction that forms when you vape. And so they've done a really amazing job of educating and promoting that message this year. So there's many other data points we could look at, and I could like dive into those at some other point, but this is just really the high level of some of the more interesting points that we are looking at that informs us of our programming and what else should we be doing. That's what I got.
Thank you, Kim. I appreciate you sharing the data and like some of the analysis that you've done at a school district level and the programs that you've all put in place to support kids that we've seen throughout the data. So thank you for your presentation. The data was really clear and for all the work that you do.
Yeah, happy to present.
Thank you. Okay, so I recognize you have all been talked at for a very long time, which we learned in the You Facilitate training is not facilitation best practices. So we're going to stop that right now. And what we're going to do is break out into small groups. So Christina, do you want to pull up the next slide? And let's just take a minute to talk through the vision for the next like 15, 20 minutes or so. And Christina, jump in at any point. Facilitators, ask any questions that you may have. And again, we've done this in the past in a big physical space, and this is our effort to do it in a virtual space. So you are all going to have an opportunity to participate in one of 4 small groups. So the small groups that you can join are either Community Life, which is data specifically around how you rate Tahoe Truckee as a community connectedness, some of those data points around feelings of isolation. So what you will find when you go into the small group, so I should probably start with that, is for example, for Community Life, you'll have access to the data points that I shared that reflect Community Life, as well as some of the California Healthy Kids Survey data that reflects kind of connectedness at school, as well as a whole host of other data points. So as Kim shared, she just kind of shared like a high level overview of some of the key findings from the California Healthy Kids Survey. I shared some of the key findings from the community survey. We have a lot of other data points that kind of fall into these different buckets. And so we just want to make sure as staff, you have access to those data points. And so you can go into one of the 4 groups. So Community Life, Substance Abuse and Use, Mental Health Knowledge and Attitudes, which also includes Stigma, and then Treatment. And so again, each small group will have slide decks that you can access once you're there that include the data points Kim and I reviewed, as well as some additional data points. And so the intent is for you to go into your small groups and just have a conversation with the folks that are there who are also interested in these data points. And so we're going to ask that you all take about 5 minutes to review the data. And so you can either go to specific links on our website, and Christina, maybe you can help me with this as well. And then, or you can access it on a PDF. Is that correct, Christina? And look at the slides that way. So Christina and Caroline, thank you, Caroline, if you're still on the call, I appreciate you. So if you go to our website, so Christina will also put the link in there. So you can click on, let's say you're in the treatment room. You can click on the treatment data link, and all the data points that reflect treatment will be brought up, and it will help inspire and give you some fodder for things to talk about in your small groups. So in just a moment, I will ask you to choose a small group. Again, one of the 4 areas: Community Life, Substance Abuse, Mental Health Knowledge and Attitudes, or Treatment. Once you are there, you can click on the link on our website to look at the data as you're talking. We will ask you to spend a few moments in silence looking at the data, getting yourselves grounded, and then really talk about what stood out from the data. Why did it stand out? Do you see this data reflected in the work that you do? How do you see yourself, or how could you see this data informing the work that you do? So again, this is kind of the meaning making part of our data extravaganza. The main room will focus on kind of the overall key findings, and we'll have Spanish interpretation. So I will say in the main room as well. And if you have any questions about the data, like please feel free to like raise your hand and I can hop over and do the best I can to answer any questions that you have. So why don't we do this for about, I know it's a lot, why don't we do it for about, let's do a check-in with you all in 15 minutes, and you can say if you can let us know if you need 5 more minutes. Does that work, Christina? And we'll kind of plan for 20 minutes, and then we'll just come back and have an opportunity to share any high-level takeaways that you would like. So Betty, I hope you all had a moment or two just to kind of check in on the data and start the conversation. And again, we realize this is a very high-level overview, quick snapshot, and again, we hope that you all take this data back with you to your organizations, talk about it with your colleagues and peers, and again, bring any questions or any further conversations you would like to have as a collaborative back to Christina or I. I will remind you, this is your collaborative, and so please let us know how we could best support your work. And so I'd love if each of the facilitators could just give like a 1 or 2 minute like quick overview of any of the conversation that you talked about in your small group. It doesn't need to be perfect, even if it's like one insight, just to kind of get a sense of what folks talked about. So Kevin, can we start with you? Thank you.
Yeah, so we talked about the graph and the substance climb, or decline rather, and we kind of came to the same general consensus that we kind of don't think it's going down. We think substance abuse is back up, especially alcohol use. We don't think it's gone down, especially since COVID's ended, or well, socially ended. That people are starting to get out and go drink it again, and it's such a prevalent staple within our community. It's kind of interesting to see the data that's showing that it goes down. But the drug usage is always an unfortunate reality. And then we talked a little bit about that stigma that, you know, all the Bay Area people are the ones bringing the drugs, but it's not the Bay Area people. They're just kind of seeing it for the first time because we're such a small community where everybody knows everybody, at least by the 3rd degree. And, you know, it's here. It's something that's in our everyday lives here in the Truckee Tahoe area. So yeah, that's what we came to.
Thank you, Kevin. I appreciate the quick update. All right, Phyllis, how about you next, and then Heather?
Thanks, Allison. Our group was talking about the community life, and just generally speaking, we were talking about, we started off talking about how the data point about being a fair or poor place to live had increased, and yet most of the other markers had gone up. So that just sort of raised other questions, the dichotomy of that stat. Then we got into talking about, you know, the connectedness and just how fragmented a community we do have. And so, you know, even the people, you know, having time to connect, especially through COVID and that sort of thing, just how different that is for the different demographics, who has time to connect even. So talked about the peer support models that were discussed and how those really do help form those connections and strengthen those connections. And then we kind of digressed into talking about how the community is changing with the influx of new people who aren't necessarily working here, that might be working remotely, and what that is going to do to connectiveness going forward, and what this next round of data points would show, what trend might be developing with this new information, if you will. But overall, we were just emphasizing, you know, how do we build these connections now again on this side of the pandemic, and being able to meet in person again and that type of thing, and just how important that is, especially for some of the demographics that were broken out. We're just very grateful for that disaggregated data so that we can examine at those levels.
Thank you, Phyllis. And I think those are good questions that we should ask ourselves as a collaborative moving forward as we move to this next phase of the pandemic for sure. Okay, Heather and then Jasmine.
Hi, we were the knowledge and attitudes room. We did not quite get through looking at all the data. Some people were on their phone and weren't able to pull it up. So we were just sharing a screen and looking at it on there. But some concepts that came up is one, a surprise in noticing that populations who qualified as very low or low income, showing such a greatly increased level of awareness of resources, potentially being related to the amount of outreach that was done, specifically noting the work of the promotoras in the community, and really getting out there and sharing that information. And that also there's over at the hospital noting that there's been a lot of challenges, particularly with the senior population with everything needing to be accessed by technology, and individuals just not feeling quite as comfortable or as trusting of using the technology. Also noticed that the increase in awareness didn't necessarily correlate with feeling like mental health is easy to talk about. So potentially some more work to be done there. And we had a little bit of a conversation about just hearing about all the concerns about accessing mental health treatment in terms of the cost, a lack of certified therapists, with interpretation services, and places not accepting insurance and wanting cash up front. So all of that making mental health services really hard to access. However, at least it sounds like with younger populations, people have been really open to using Zoom and find that that actually can feel a little bit more like private and not having to go into a doctor's office. That was kind of where we got to.
Thanks, Heather. I appreciate you jumping in and facilitating. All right, Jasmine, we are going to bring it home with you for the last 2 minutes.
Right. So we talked a lot about insurance and access within our providers and looking at our kind of providers and what they accept and comparing it to other counties in Colorado and Utah. I shared a little bit about some of the discussions we had with other communities about strategies that they've done to increase providers accepting insurances and using more of a therapy collective model that supports billing. And so we talked a lot about kind of that while we have a lot of disparities, our disparities match what other communities have experienced, and those communities are now moving forward through those barriers. So I feel like there's some hope. We just got to do the work and figure out how to do it. And then the other thing we talked about was kind of the low income households that were underinsured, and then also the underinsurance rates in general, and just the challenges that creates with access to services. We talked about, is there opportunity within employee assistance programs? We also talked about a pilot strategy that Placer County and Sierra Community House will be doing with Medi-Cal outreach at food distribution, and talked about, if that's successful, expanding it maybe to TTUSD and back to school parent nights to try and reach a broader audience, because the confusion about who's eligible and how to access Medi-Cal is sometimes completely overwhelming, and people don't pursue it because they don't think it's worth their time. So really talking about ways to move the needle on that data point specifically.
Thank you, Jasmine. I appreciate that quick overview. All right, you all, well, it's noon. I appreciate you all sticking with us. I know the data can be a lot. And again, the data is now all at your fingertips. Like, please use any of the slides. Christina, thank you so much for taking a ton of data and culling it down and working on the visuals. It's a ton of work. It takes hours. So I appreciate you creating a repository of data for us all to use. And so again, please let us know how we can continue to share this with you, your colleagues, your organizations, your boards, whomever, and we'll continue to work on how to share it with the community at a broader level. So thank you all so much. We are not meeting in July because we are taking a little bit of a summer break, and it falls right around the 4th. And so we will see you all back here in August, and I'm sure many more times before then. So thank you all, facilitators, and you all for doing the work you do. Thank you. Okay, bye.